My background most recently has been in the charity sector, and prior to that in the pharmaceutical industry for about 10 years. My only touch with allergy is a friend that had a peanut allergy, and she just told me to move the pot of nuts away from her when we went out for a drink. And so you probably wonder, why would I be wanting to work for the Anaphylaxis Campaign? Well, when I found out about it and the good work that they're doing, and then started to understand what people are having to do in order just to live a healthy life, I felt that I really wanted to do something to make some change. So that's why I've come to the Anaphylaxis Campaign. Many of you will have come to our meetings before, and you will know Lynn. And so you will know a lot of the main messages that Lynn puts out. So I've taken a slightly different tack, and I've been thinking about what would you want to hear from us today. So I want to talk to you about how we can support you to support your patients or the people that are within your care. So we're looking at our strategy now. We're going to be having a strategy away day. We're going to be looking at our priorities, and we've grouped our main priorities into 4 different areas: information, support, campaigning, and fundraising. I'm going to cover information and support, which sounds quite dry and boring, but I hope by the end of this you'll think this is a really useful service that might help you in your role. The campaigning, I'm not going to talk very much about that, but we were instrumental in bringing about the spare pens in schools. Lynn has been actively campaigning with other groups to make that happen, and we're delighted that that's now in place. Although we recognise there's a lot of work still to be done there to make sure that the schools understand what they can do and what they should be doing. And we can't make all of the great stuff that we're doing happen without fundraising. We receive no core funding, so everything that we do is thanks to your membership and thanks to any fundraising that we're able to do for us. And also the sponsors that you see here today. And I know sometimes going around the stands it can be a bit of a drag, but really without those people supporting us we wouldn't have been able to put this event on. So if you get a chance to pop round before you go, then please do. So on Tuesday this week we were really busy on our helpline. Some of you all know about our helpline. And I'm new in post, nobody rings me, but my phone went, so I thought, oh, I'll answer this, I need a bit of a break. Anyway, you never know what's going to happen at the Anaphylaxis Campaign, that's for sure. So this lady was on the phone in quite a high state of emotion. I wouldn't say anxious, crying or anything like that, but high state of emotion. Because that morning at 7:45, her daughter, who hadn't previously had any reaction, had a reaction to a persimmon fruit. So it's 7:45 in the morning. 5 minutes later, the mum, who is a lollipop lady, I don't know if you call it the lollipop lady anymore, but she shows the children across the road. She would have been gone, so the daughter would have been on her own. So this is a fabulous mum because she's made pancakes for her daughter for breakfast with this persimmon fruit, which is on special offer at Aldi. And for the other daughter, she's made a smoothie. And I'm thinking, wow, I never really did that for my boys. They were lucky if they got to school on time. So I'm thinking, wow, I'm really impressed. So anyway, this young girl, the first bite of this persimmon, her tongue started to swell and her throat started to swell. And her mum realised something was happening. So she couldn't find the Piriton. And then it transpired that her husband had used the last bit of the Piriton. So she quickly dashed to the GP surgery. Fortunately, they were just opening, but they hadn't even switched their computers on. So she went in and she just showed her daughter to these people in the reception. Very quickly, they realised what was happening, and they sent the mum to Tesco Express across the road to get the Piriton. So by the time the mum had come back, they had given her daughter adrenaline. Then they had called the ambulance service, and the ambulance service were just arriving. So that was great. So she went down to Southampton, was very well looked after. It transpires that the daughter had a spring-summer hay fever problem that hadn't really been identified previously, and they thought that was linked to tree pollen. And that this persimmon, there was some element of birch tree allergy. So is that right? Yeah. So they looked after her, they kept her for 5 hours, they gave her steroids, they gave her adrenaline, they monitored her BP, and then they released her back out. And the daughter's had a couple of days off school and she's fine, so that's great. But the mum rang up, highly emotional. I would say in a state of shock. I've done a little bit of counselling. I would say that this woman just needed to talk. She just needed to tell somebody what had happened that could give her some time and that could understand and that wouldn't talk over her or make assumptions. So I suppose in that way she was quite lucky that I picked the phone up. But I was very lucky because she told me about if it had been 10 minutes earlier, the surgery wouldn't have been open. And she said, I was in such a state of shock, I didn't know what to do. She said, now I know I should have dialed 999. She said, but I didn't know at the time. She said, I was really well looked after by the surgery. They were brilliant. She said the hospital were fabulous in the way they looked after my daughter. The allergy nurse came round. She said, and it's been really good service. She said, but I'm Googling now, and I can't understand what's happened to my daughter. So she's been on Mr. Google. And you know, as healthcare professionals, you don't want anybody really doing that, do you? And then she said, I found out all of these things. She emailed Aldi, thinking that they would do something. They recorded it as a product complaint. And I mean, it's a piece of fruit, isn't it? I mean, they haven't done anything wrong. But of course, as a frustrated mum wanting some understanding, she didn't find that very helpful. So I was able to give her quite a lot of resources. We've got a lot on our website, and I'll talk to you about that in a moment. So these are some of the things that she wrote to me, because she's been writing to me quite a lot, and I'm really happy that she does that. So these are her words. So about her surgery, fabulous service. She can't fault them. And this is really raw, new and scary. And I can imagine how that feels. Her daughter's 14, and she's eaten fruit previously that she's had no reactions to. And she said, it's opened my eyes. If I'd known. There's so little awareness. I spoke to the school. They seem to think they can only have the AAI when they've got a qualified nurse on standby. And we know that schools don't have one nurse per school. Even Cambridge, not all of the colleges are having one nurse per school. And this is where we can come in. So what I'm saying really is that the healthcare professionals provide fabulous resources, but as soon as that patient walks outside of the hospital or the surgery, they're into Google land. A lot of the time they're not given any information about us, and we're working with healthcare professionals to say what would be useful for you to give to your patients that will help direct them to us. So if we just think about the scenarios, so there was the GP surgery, there was the hospital, there was the supermarket, and then there was the big wide world. So what could we have done? What could have happened a bit better? Well, if the surgery had taken our allergy-wise training, they would have probably known more that they could have told the mum. If they'd taken our patient information leaflets, they could have given her an information leaflet to signpost her to us. At the hospital, they could have done the same. One of our previous speakers, I think it was Emma from Cambridge, talked about the allergy-wise training. This is a fabulous suite of training that you can take. For a healthcare professional, there is a small charge, but for parents and carers and schools, it's all free of charge. It's really good. It's really easy to understand. You don't have to be writing notes to pass a little test at the end. But it's really worthwhile doing. And so if you haven't done it, I would really urge you to do it and tell everybody about it, because this is such a fabulous free resources here. So we have the Allergy-wise for GPs and practice nurses. It is more in depth, and you do get a certificate afterwards. So if you're thinking about CPD, then that's useful. The Allergy-wise for healthcare professionals is a train the trainer course. So if you want to do it, then you can train other people within your departments. So I would definitely ask you to have a look at that, even if you decide eventually not to do it, but do have a look. We have a wide range of resources, and all of these are medically approved by our clinical panel. And we can't think of anywhere else that you would receive better resources to support your patients. Our website is quite difficult to navigate, very difficult to navigate, but we're going to be improving that. But if you want any resources, any leaflets, any posters, we have a lot of information on Facebook. That's one of our main communication channels. We put a lot of information out. But we also do webinars. There are a lot of webinars on our website, and they're about a variety of topics. So the most recent one was about latex allergy, and I think George did one before that, and I think that was paediatric. We've also got lots of films. You'll be aware of the Take the Kit film. That's really useful to help you raise awareness. We've recently put a film out by Immune, which was about a little boy feeling excluded from a party. And that generated a lot of discussion, which is really good. It's good for people to talk about this because it creates awareness. And we've also got some GP small training courses. So there's loads of information. We've got a helpline. And because this has become so successful, we're just about to take on somebody else to help Grace. Probably many of you have spoken to Grace today, and she will be starting on Monday, and that's Katie. Both fully qualified to be answering most of the medical questions that are coming through. This just gives you an idea of who's ringing us, and you'll see that there's about 33% of people ringing us are actual healthcare professionals. So the school nurse and healthcare professionals get quite a lot of parents and carers ringing. So this is a really good helpline that's manned 9 till 5 every day, Monday to Friday. If there are too many calls coming in, we all endeavour to get on the phone to make sure that nobody's feeling that they're not being supported. And so if you have anybody that you think would benefit from this, or if you think it would be useful to you, then give us a ring, because Grace is up to date on everything that's happening. So if you want to understand more about legislation, or what are we doing with prescription charges, or how can I help my school understand what they need to do, then Grace is a great person to be ringing, because she knows what's happening and she can signpost your inquiries to the rest of us. So already we've had a 30% increase on the number of calls coming through to our helpline. We haven't been proactively marketing this or promoting this website and this service, and we will be. So it's interesting that already this year we're 30% up on last year. So we're getting about 13 calls a day, which is quite a lot, because these calls can be quite a long time. They're not sort of a, can you send me a leaflet, thanks very much, goodbye. A lot of it is listening to what people are saying and trying to support them and understand what it is that they need. So these are the top 6 topics that we were asked in October. So a lot of questions about the change in legislation to have spare pens in schools. Issues around travelling. There's been a lot in the media recently about concerns about travelling on planes. Lots of confusion about allergen labelling. We do put out a lot of product alerts, and so that's possibly encouraging people to contact us with more questions, maybe to understand a bit more behind that. Auto-injector supply issues. People become quite frustrated that their prescription can't be fulfilled, and they just want to know what is the up-to-date situation. We are lucky that we have very good relationships with the manufacturers and the pharmaceutical companies, so we can get straight on the phone and just say, why is there problems in Hampshire? And they can come back and tell us what the status of that is. There's also been some changes to the administration of EpiPen, and people have been just questioning, what does that mean? Can I use it with my current EpiPen, because maybe my current EpiPen still says 10 seconds. And lots of inquiries about the Allergy-wise training course and which course would be suitable. So that's the top questions that we're coming across. So that's about it, really. I'd encourage you to visit our stand. We've got lots of information there, lots of really good fact sheets. You can't take some of the fact sheets away, but if you'd like them, we can send them through to you. Have a chat with our team. If you want to support us with fundraising, that would be fabulous. And we've got lots of fundraising opportunities coming up. I hope that's been of use, and I hope you'll try us out and you'll test us. And if we're not supplying something that you think would be really vital to what you're doing, tell me, and we can make that happen. Thank you very much. Thank you.